Welcome back to my YouTube channel. If you are new to my channel, welcome to Medcoding site. Hi, I am Nishaba, a certified medical coder. In this video, we will discuss office or other outpatient service, the first category of the evaluation and management course. We will also cover new and established patient, the two subcategories of the office visit, and how to distinguish between them. Let's begin the video with the goal of providing a better understanding of evaluation and management coding related to office or other outpatient services. Evaluation and management services are cognitive as opposed to procedure services in which a physician or other qualified healthcare professional diagnoses and treat illness or injury. Office or other outpatient services are provided in the physician office or in an outpatient or other ambulatory facility. A patient is considered an outpatient until inpatient admission to a healthcare facility occurs. Office or other outpatient services are further divided into two subcategories: new patient and established patient. The subcategories of evaluation and management services are further classified into levels, each identified by specific codes. The level of evaluation and management code is determined either by medical decision making, MDM, or time. A new patient is one who has not received professional services from the physician or any other qualified healthcare professional of the same specialty and subspecialty within the same group practice in the past 3 years. Whereas established patient is one who has received such services within that time frame. To understand the concept of new and established patient, let's break the definition into three key components: professional service, the 3 year rule, and different specialty and subspecialty within the same group. Let's discuss each one individually. Professional services are face to face services rendered by a physician or other qualified healthcare professional who may report evolution and management services. If the provider has never seen the patient face to face, a new patient code should be built. To understand this rule, let's take an example. A patient presents to the emergency department with chest pain. The emergency department physician orders an electrocardiogram, which is interrupted by a cardiologist on call. The cardiologist will 93,010 electrocardiogram routine ECG with at least 12 leads, interpretation and report only. The patient is sent home and asked to follow up with the cardiologist next week for coronary artery disease. At that visit, when the patient follows up with the cardiologist next week for coronary artery disease, it will be considered a new patient visit because he only interpreted the EKG and did not see the patient face to face. Let's take another example to understand the professional services given to a patient returning for a follow up regarding ongoing treatment will be considered as established patient visit. A 45-year-old male with past medical history of well controlled hypertension presents to the office for a routine follow up. His hypertension is well managed with his current medication. He denies any symptoms of chest pain, shortness of breath, headaches, or dizziness. The final diagnosis is hypertension, well controlled on current medication. No change in treatment is necessary at this time, and the patient is instructed to continue his medication. The scenario involves the returning for a routine follow up regarding well controlled hypertension. Based on this, the patient will be classified as an established patient because the patient has already been under the care of physician and is returning for a follow up regarding his ongoing treatment for hypertension. Let's take a simple example to understand the next key component of the 3-year rules to understand whether a previous face to face service has or has not occurred within the past 3 years. A patient is seen on November 1st, 2015. He moves away but returns to see the provider on November 2nd, 2018. On November 2nd, 2018, patient visit will be considered a new patient visit because it has been 3 years since the date of service. To understand the distinction between the specialty and the subspecialty within the same group, let's take an example of a specialist medical oncologist and a subspecialist neuro-oncologist, both within the field of oncology but still part of the same group. Mr. John Smith has been undergoing treatment for cancer with Dr. Robert, an oncologist at Medical Group. During his follow up appointment, Dr. Robert identifies some neurological symptoms that require further evaluation. Dr. Robert decides to refer Mr. Smith to Dr. William, a neuro oncologist. Although Mr. Smith is an established patient to Dr. Robert, but when he sees Dr. William, it will be considered a new patient visit. This is because he has never seen by Dr. William before, and the referral to Dr. Williams is for new type of care, especially related to neurological issues that haven't been addressed in his oncology appointments. Another rule in the CPT for classifying new and established patient is that if a physician or other qualified healthcare professional is on call or covering for another physician or healthcare professional, the patient's encounter will be classified as it would have been by a physician or healthcare professional who is unavailable. Let's understand with an example. Michael Thompson has an upcoming appointment with his primary care physician, Dr. Sandra Lee, on October 10, 2024, for a follow up regarding lower extremity swelling. On the day of the appointment, Dr. Lee was unavailable due to personal reason. Dr. Karen Davis, another physician, covered on call services for Dr. Lee. Michael has not been seen by Dr. Karen Davis before. The visit will still be considered an established patient encounter as the patient is under treatment with Dr. Lee and is coming for a follow up. The same classification applies when the Dr. Davis covers Dr. Lee's services. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.